What a great panel. We're so grateful to Amazon and to the White House and to our own Mike Carney for really helping us think about public-private partnerships and what they can accomplish kind of in this time. So now we'll move on to another public-private partnership. The U.S. Chamber has been really proud to facilitate some discussions and actions to leverage the strengths of private industry and our government to shape the path forward. We know that there is this need for private sector leadership globally, and it's why we have, in partnership with the Business Roundtable, launched a global task force on the pandemic response, as I mentioned in my opening earlier. The sponsors of this forum, Amazon, Google, and UPS, are on the steering committee of the task force, and we're grateful to their CEOs for the key role that they have played in this effort. Altogether, it's leadership of more than 50 companies involved in this initiative that have resulted in 1,000 ventilators set to be delivered in India by June 3rd, 25,000 oxygen concentrators set for delivery in the coming weeks, and importantly, the creation of a network of human resource officers and leaders who can share ideas and information to help the people of India. So here to talk about this global task force today are three leaders who have really been at the heart of this unprecedented mobilization of the business community since the start. We have with us Julie Sweet, the CEO of Accenture, Arvind Krishna, the chairman and CEO of IBM, and Brad Smith, the president of Microsoft. So we certainly have a lot we want to ask them, so let's dive right in. Julie, let me start with you. Can you explain what the Global Task Force is and how it came about?
Sure, great. Thanks, Suzanne, and thanks for having us today. So first of all, let me start with what is at the heart of the Global Task Force. And at the heart of the task force are the three C's: connection, commitment, and collective action. And it's the connection of the U.S. health and economic security to resolution of the global pandemic crisis. It is about commitment for U.S. companies to protect the health and safety of its own employees everywhere in the world, but also our longstanding tradition of a commitment to be a force for good in the countries where we operate around the world. And finally, it's about the power of collective action. It is taking the basic principles that we each operate under: focus, scale, diversity of experience and thought, and bringing together the private sector to work on these big problems and to work with governments. And so as you think about the Global Task Force, remembering connection, commitment, and collective action really helps you understand what our priorities are and how we'll move forward. I want to take you back to the weekend of April 23rd. It was a Friday, and my own leadership team and I were looking at alarming statistics coming from India. Literally in 1 week, our COVID cases had increased 160%. The news was reporting a surge that we now know is the deadliest and the fastest since the pandemic began. Several phone calls the next day to other companies, including Brad and Arvind. Was clear this was a collective experience. And by Sunday, we had almost 20 CEOs on a call. And those three C's were exactly what we talked about. And then in the coming days after that, it grew to over 50 companies. All of us, not one single company, committed to lead and to say, how can we have this collective action in order to make sure that we're both protecting the health and economic security of the U.S., our own employees, helping the humanitarian crisis, and doing so at speed. You just heard from Dave and Andy the power of the public-private partnership in our own country. And this was a huge lesson for all of us. And that was the mindset that each of the CEOs brought together. But we also saw unprecedented collective action during the pandemic among pharma companies, for example, to solve both the creation of vaccines, but also the manufacturing. And it is these models that we said we now need to turn to the global pandemic. And India being at the heart of not only this unprecedented surge, but the reminder of how critical resolving the global crisis is. And I know Brad and Arvind are going to get into it more, but in terms of just as you think about our health and economic security, the generic drugs that we each take, 1 in 3 is produced there. 60% of the world's vaccines are in India. Parts of the cars that we drive, the banking transactions when you go to your ATM are helped facilitated by advanced IT services. There isn't really a part of our individual American lives that is not touched in some way by the deep partnership that we've had with India for decades. And just as they were there for us at the beginning of the pandemic, we also want to be there for them from a humanitarian perspective. So that's how the task force came about. It's what we're committed, the 3 C's are what we're all about. And what I'm probably most inspired by is just how everyone has rolled up their sleeves. This is about a collective group of CEOs and government leaders, not one single company.
Thank you for that, Julie. I remember that Sunday, and one of the things that stuck in my mind was the CEO who was wearing the "Science Will Win" t-shirt, which I thought was so fantastic. So let me bring Arvind into the conversation, and maybe you could describe for the audience here what the task force activities on the ground in India look like. How is this mobilization impacting people of India right now?
Thanks, Suzanne. So look, first of all, we must all acknowledge the immensity of the crisis that is going on in India and what we must all do. It's our responsibility as members of the community to go help as much as we can. And Julie spoke of that. It's also important to reinforce the critical nature of the business relationship on both sides, because the impact on all of us as citizens and consumers will be immense. Now, that said, what the task force did was we collectively get a lot of feedback from our employees and our leaders in India. They are also in touch with the different state leaders as well as the central government leaders about the Prime Minister's task force on COVID. From that, we got the feedback of a number of essential items. While vaccines is much more in the purview of government, and I'll come back to that in a moment, of 3 items that they all said they need and they wanted our collective action on. One is the oxygen supply chain. And Suzanne, you mentioned a couple of things, but I'll add some more detail on that. The second is around hospital and access to medical care. And the third is the sharing of best practices. So this wasn't top down or theoretical. This is based on actual needs that our employees and their families all wanted. First, on oxygen. Now, you spoke of the ventilators. Medtronic has already agreed to supply 1,000 ventilators. These have been procured. 100 of them are on the ground, more are on the way. This includes an end-to-end training so they can go into hospitals and be effective. The 25,000 concentrators you spoke of, 5,000 are on the ground, and all 25,000 are intended to be on the ground by the end of May. And these, together with the Red Cross and the Indian government, are being distributed to the points in need. Just for the audience to understand, there isn't enough capacity in India to get oxygen from the point of creation to the point of consumption. Concentrators alleviates that issue, albeit in a temporary way, while more oxygen creating plants are being produced. Hospital beds, how we all collectively act, working with in-country medical facilities to create more capacity, is the second big collective action that this group has taken. And all of our CHROs, our human resource officers, have gotten together to share best practices, including telehealth, monitoring, home health kits, increasing insurance coverages, making sure that elder care is taken care of, a variety of actions, all collectively. Much as I'm really proud of the speed at which we brought our resources to bear, Julie references that Sunday call. If I recall, Julie, by the end of that call, within 30 minutes, I think collectively, I forget how many, over $10 million was raised. People committed on the spot. No bureaucracy, no action, no going back to boards and committees to get moving. And then a number of us stood by and said, okay, we'll act as backstops to put resources, including people, actions, websites, all to bear, and including people getting together in India to act on these topics. Now, all this said, Suzanne, it would be remiss of me not to say none of us can marshal the resources that the US government could bring to bear. And so we are also working with the US government to get them to bring their immense resources to bear to help alleviate this crisis.
I was going to go around the table, but since you just said that, let me ask you to follow up a second question, which is really the task force has been working, as you just said, with the U.S. government, but also with the Indian government. So what are, Arvind, let you keep the microphone and tell us what are the main messages that the task force has been conveying on both sides?
Thanks, Suzanne. So we met with the Indian External Affairs Minister, Jaishankar. We have also spoken to Ambassador Sandhu. We have also individually, I know many of us on the task force have spoken to different members of the Indian government. What they have conveyed is, one, they are acknowledging the immensity of the crisis. What they speak of is they would like a lot of help on a number of topics. If you remember, the first topic that came up was vaccine production. Julie talked about vaccine production in India, and they need the supply chain to be opened up. And they have mentioned that, and that is work that hopefully with the announcements yesterday and over the past week from the White House, with what Jake Sullivan as well as Samantha Power have agreed to, hopefully a lot of that will open up. Not just manufactured vaccines, but the ability to manufacture vaccines in India. The two items of immediate need that they all want is oxygen, and the next is therapeutics. And those are things that the Indian government has asked for. But what I got back, Suzanne, which is incredible, is that they have helped shortcut the red tape. As many of our folks in the supply chain industry, Federal Express, United Airlines, DHL, we all know that distribution within the country can often take much longer than any of us would like. And so speaking with the government officials, what they have done is really helped, I'll call it, shortcut is the wrong word, but expedite landing on the ground and trying to get these critical supplies to the point of most need has been a huge help. They've also helped a lot with trying to get access to different medical care for our people in the country. So those are things that I think have been very positive. But the biggest is their ability to want to coordinate with the US private sector, and looking at us to also help coordinate with the US government has been areas which I think is maybe a first for the government of India.
Thank you for that. You know, Brad, Julie mentioned that first call. And one thing I remember from that call, besides the t-shirt, which I already mentioned, was your idea right from the very beginning that this had to be a global task force, that it was going to have to think about reach beyond India. Can you describe why the task force had that impetus really from the beginning?
Well, sure. And thank you, Suzanne. And I think even from that first call, I mean, the leadership of Julie and Arvind and the involvement of Accenture and IBM has been of just, such critical importance. I think it does require a recognition that this isn't going to be isolated to India, and we need to act around the world. One of the things that I think is insightful but sobering is just frankly the parallels between what we're seeing today and what we saw in the 1918 influenza a century ago. In that incident, 500,000 people died in the United States, about 15 million people died in India, about 50 million people died globally. And what it really reflected is the fact that the infection then, like today, spread around the world, and it caused the most deaths when it overwhelmed the healthcare capacity of a nation. And that is exactly what is at stake right now. And the good news is I think we have three assets that we can bring to bear in the 21st century that didn't exist at that time. The first is we have real-time data on a really unparalleled basis. And that enables us both to see and then to predict that this is going to lead to other hotspots. It already has, whether it's a Peru or a Brazil, and we're going to see this continue, we should assume, at least over the next year. The second thing we have today is a global supply chain, really at an extraordinary level. And the companies that are participating in the task force are at the heart of that supply chain. So it is this ability to secure oxygen-related equipment, buy it where it is being produced, and ship it by air with chamber and task force members to the countries where it's needed. And the third thing we have is people on the ground pretty much everywhere. You see that in the CHROs. You see it on employees who can volunteer locally. You see it in employees in Washington, D.C. who can help forge a connection with the federal government in the United States. So the need is global and our capability is global. And that's why I think it's this combination of connection and commitment, a commitment that ultimately I think is really about saving lives around the world.
Let me, again, while you have the microphone, and then I've got another question for Julie. Let me double down on that for a second, Brad. So do you think that this task force is learning lessons, creating a playbook that will, I mean, we're talking about the global economic recovery as well as the health recovery at this forum today. Do you think this playbook and these lessons learned are a key part of that?
I think the answer is a resounding yes. And I think we need to focus on job one, which is saving lives that are at stake with COVID around the world. But I believe we're developing a new capability as a country to help marshal humanitarian assistance where it's needed around the world. I was at the White House last Wednesday, and one of the things that people noted is they had never seen the business community respond as quickly and as impactfully as it has since that first call that Julie mentioned last month. And that's because of all of these capabilities that we now have. The last thing we should do is apply this here and then set them aside and forget them. And what we should recognize, I believe, is that we're also discovering how the public sector and private sector, in fact, complement each other. As Arvind said, we will never match the United States government for, say, the amount of resources that can be tapped and then moved so quickly. But we also have resources that the government doesn't have. We have more people on the ground. Our people on the ground are really part of the local community in a way that, say, typically a United States government employee is not. We've got the data, we've got the supply chain. One of the things that people in the government have noted is we had access to supplies that they would have never known about. So if we can really sort out what we can each uniquely contribute and how we can each organize ourselves and then coordinate together, this is something that I think can do good for the world and advance really the role of the business community, not just in the United States, but globally.
Could not agree more. You mentioned people on the ground, and that's actually where I wanted to go with Julie for a minute. Julie, from the beginning, you've brought in a real human side of what's happening on the ground in India, how heartbreaking it is. And a number of the CEOs on the task force are dealing with their own workforces on the ground there and trying to help the families stay safe and stay healthy, and also the communities in which they operate. So can you talk a little bit about that specific challenge as a CEO?
Yes, thanks for the question. I want to make sure to recognize, though, as I begin, the role of the U.S. India Business Council, the USIBC, and the US ISPF, the India Strategic Partnership Forum. Because when we think about the collective action and also people on the ground, we've really benefited so greatly from the deep partnerships and the knowledge that you have. And we could not have moved as a private sector as quickly as we have without the USIBC and the US ISPF. And I think that's really important because it's government, private sector, and then these critical organizations like the Chamber and like the Business Roundtable that came together. And as Brad said, this is really a new way of working, but it's bringing the insights, the access, the scale, and the speed that's so different as we move forward. And in a world where we've been incredibly disrupted by the pandemic, it's great to see something so positive coming from it. And as you think about our people on the ground, we as companies start always with our people, right? That is our responsibility as employers. And it is absolutely heartbreaking. All of us have colleagues who've been affected. We've lost colleagues, we know their colleagues, our colleagues who've lost family members. And we have many colleagues in the outside of India who are watching, really feeling helpless. And it's really important that we recognize that the collective action here has been about also how we can help each other. And so as Arvind talked about, and you did, we have literally over 200 CHROs who are on calls every single week, sharing the best practices. Things like how if you put together a home health kit, it allows telehealth to make sure that employees don't go to the hospital when they don't really need to go to the hospital and take up beds that are needed for others because they've got the right monitoring and the right supplies. And then getting those supplies, took our partners around the world, as well as the logistic partners, to actually, as they ran out in India, to get them. And all of that in helping our employees is also helping the communities by preventing some group of people from having to use healthcare capacity that is overrun. And so when you go back to the connection, commitment, and collective action, all of this is intertwined, right? In terms of what we can do for our employees and for the communities. And there's been so much innovation. We provided for the first time ever telehealth capacity outside of India into India to help alleviate. And now that was with our partner, United Health Group, and other partners around the world are doing the same for other companies that, again, came out of the collective sharing of what the art of the possible was, and then that industry coming together to share how to do that. So it really is a lesson, and you go back to the build back better, as Andy was talking about, and the public-private, and including the not-for-profits and the trade associations has been really critical.
Thank you, Julie. I want to ask all three of you the same question in a little bit of a lightning round here. And Arvind, I'm going to start with you. So we're talking today to thousands of people in more than 140 countries on 6 continents. And I imagine they would all look up to the three of you and say, okay, you're global leaders. This has been a really difficult time. This has been an unbelievable disruption, almost beyond our ability to perceive it in the moment. Why should we be optimistic that we can get back to health, that we can get back to economic health? And so Arvind, starting with you, what makes you optimistic right now?
Oh, it's very simple. 3 reasons. One is actually where you started, Suzanne, science. We have the science that will let us get through the pandemic quickly. What the various pharmaceutical companies, vaccine makers, but more than that, all the epidemiologists, all of the scientists have done is remarkable. Standing on a firm footing of science always gives me a lot more optimism than just anecdotal ad hoc reactions. Second, the private public. I'm putting it in that order because the private in this instance reacted a lot faster. Public came along. Hopefully public will get bigger faster, but that's the second reason. And the third is the eternal optimism of our people. Julie mentioned some of the people's reactions, but we have employees in India, 100 of them get together and supply oxygen to each other because one of them figures out where to get it from. Somebody else figures out how to get a hospital bed. Somebody else figures out how to get a therapeutic. That human spirit, it is our role as leaders and CEOs to keep it going, to sort of nurture it, not to let it get out. Those are my 3 reasons for optimism on the economic recovery, not just the health recovery.
I'm going to have those Science Will Win t-shirts, and you're getting the first one. Julie, I'm going to ask you the same question. What makes you optimistic right now?
It's when you think back to the pandemic and the first time we've all faced what has been a very leveling experience, right? It's actually been the power of bringing the best of our global experiences. Let us not forget that at the beginning of the pandemic, India helped many countries around the world, including the US. And today, over 90 countries are dependent on India for their vaccines. And you can go around country by country and see the incredible contributions. And so what we have experienced together has also highlighted the power of working together. And I believe that we will take these insights and we will work together differently, not just within companies. We talk about that all the time, digital transformation, new ways of working, but that what you're seeing is really the next level, which is new ways of working globally for the benefit of all. And I think that's tremendously exciting as we move forward. And we have a commitment. I mean, we have an obligation to make sure it continues to happen. But I think there's a great power in unlocking all of our country's great resources, innovation, and talent.
And Brad, lastly, over to you. What makes you optimistic?
Well, I think both Arvind and Julie have captured so much, but I would say when people look back at this historically, I think one of the things that clearly will stand out is this extraordinary scientific accomplishment at a global level in developing a vaccine so quickly. And then, of course, we have to continue to ensure the vaccines are manufactured and distributed as quickly as possible. One of the government officials that all of us met with a couple of weeks ago, I thought put it very well. Success will be if this pandemic ends around the world in 2022. Failure will be if it takes to 2024. So I think we can focus on that test of success with the work to come. And if we achieve that, it will show that, frankly, humanity's come a long way. And, I would just add to that, look, this is a testament to the resilience of the human spirit. It's been a test for every one of us. It's been a challenge for every one of us, and we've lost loved ones and colleagues along the way. But we will come out of this stronger, and we just have to then come out with the resolve to put that strength to work and not let it dissipate.
I think that's right. And I'll take the moderator's prerogative and answer my own question, which is what makes me optimistic is working with leaders like you, the other members of the task force, our sponsors today, because it really shows the role that business can play as problem solver, as innovator, and that when businesses do well, they can really do good. So it's been a privilege learning from all of you and being able to do this work together. And we'll let you get back to your day jobs and this important work of the task force. Thank you for being with us.
Thank you.